So we can divide it into different parts. One is that these are the people who struggle to concentrate. So they can't focus on one thing. Then hyperactivity, that they can be quite fidgety. And even if they are not fidgety and they have to sit still, that is at the cost of inner stress or anxiety or distress. And the third part is impulsive. They'll do things without thinking. So people can still be very successful, and a lot of doctors and very successful people, nurses, psychologists, have got ADHD. But if it is identified, treated, and managed, life becomes easier for the person.
So it's attention disorder, effectively,
Yes.
and it can be managed. Is that with medication and support?
Yes. So for the management of ADHD, there's a lot of research has been done, and there is more evidence that when treated with medication as well as support, the outcome is much better. For example, if somebody is in the school and getting support in the school, like extra time in exam and things like that, that would be helpful. And then medication has a lot of evidence in its use.
And how common is it? Is it very common in the UK, and is it a real problem for lots of families?
It's very, the WHO, or the main figure is 5 to 8% people have got ADHD. In some parts of America, it's 13%, or in some parts, even 40% are identified, but there are different reasons for that. But in UK, the accepted figure is between 5
So
to
that's
7.
quite a large number of people.
Yeah.
And how would somebody, if they thought their child might have it, what would they be trying to do? How would they access services?
I think it is. It can be identified by teachers in the school, by the young person or the adult, even when they are struggling to concentrate, when they cannot focus, when they are hyperactive. All those things are there, and once it is identified, you can go and discuss with the GP, and then the GP can make a referral to the appropriate service.
So there is help out there. And how quick is it? Because lots of people always say, oh, it takes forever to get through to somebody or see somebody. Is that a major issue?
I think one of the reasons for it being a major issue, it has been identified nationally that ADHD should be assessed and managed as soon as possible. But we have to keep in mind that giving somebody a diagnosis of ADHD should be done, there should be a very comprehensive assessment, because giving someone wrong diagnosis can have long implications, and not giving the diagnosis also have negative implications. And that's why we need to get information from different sources like school, observe the young person, take a very detailed developmental history. It's important to be done it properly. And secondly, because of a lot more awareness these days, the number of referrals have increased, doubled or tripled. And that's why the services have to cope with the increased influx as well.
So it's very complicated to make sure you get the correct diagnosis.
Yes.
And it's really important that you do it correctly. Otherwise, there's risks both ways. But at the same time, there is obviously a large number of people coming through. So what does seem to be the sort of the best route? Go to your GP and then access the service, or try and be seen? And is that happening enough?
I think even there was a podcast from the president of Royal College, and even she has identified that there has been limited funding for community services in mental health, and especially in CAMS as well. So that's why obviously it needs better funding. It needs, although that has been increased a lot, but every time the funding is increased, the influx is more.
So there's lots of people out there who are looking for this sort of service and going through the process at the moment.
And I think it has to be done at different levels. I'll ask Dr. Ratore to...
I just wanted to sort of add in the point in terms of the delay in accessing and what Dr. Khan was saying in terms of the number of referrals that have increased. The assessment for ADHD takes a long time. It's not done in one assessment.
So how long would it take? 6 months or 4 months? Is there something like that?
So in terms of the criteria for that assessment, we need to make sure that we take what is called a developmental history, which easily done in detail can take hour and a half. Then we need to have information that comes from school to corroborate that information, and getting that communication from school, that information back and forth takes time. And then the clinician needs to see and observe and have a conversation with the child and the family. So this whole process can take some time. And then getting all that information, and that sometimes can be creating a lot of delays. The other important thing that we need to
So it's not a real delay, actually. It's actually for you to gather all the evidence so that your conclusion is correct, because the risk is greater if you get it wrong.
The thing that lots of listeners need to understand is that sometimes a few things can mimic the presentation of ADHD. And it's our job to make sure that we can tell it very clearly that if it's ADHD or not, because the trajectory of the conditions can be very different. So sometimes families with disruptive environments can feel that the child has got ADHD, where it might be a behavioral problem which needs a different management.
So different, exactly.
So that's why it takes more time, and sometimes when there is a bit of, let's say, a diagnostic dilemma where we need to have more understanding, more information gathering, then it can take a bit longer. But the good thing is, once you get the assessment completed and then you start on the medication, the results are very good. Majority of the people respond to the medication. Obviously, the medication needs to be titrated. The side effect needs to be managed. All the medication have some side effect. But once it's done, people notice a significant difference. And one thing I wanted to add was that the severity of the presentation varies as well. Somebody can have a mild presentation, moderate to severe. And that's where the specialist can decide that can this be managed without medication or not, and what are the other things that you can do. For example, let's say part of not being able to concentrate would lead to what some people would say memory problem. But it's actually not a memory problem, but their ability to concentrate. So you try and sort of some self-help things like you need to have a diary. So how can you manage a bit of reminder before they get ready and go to school, what kind of things to put in your bag and stuff like that. And those kind of things start to help as well. So what I wanted to say was that don't just focus on the medication. There are lots of other things which will help in the management of this.
Excellent. Thank you very much. You're listening to Radio Ramadan on 87.7 FM. If you've got any questions, the phone line is 0116 4822 or you can send us a WhatsApp message on 077 488 55055. If you've got any questions on ADHD, please give us a call or message us. We're more than happy to try and answer your questions. Autism, which is sort of on the similar sort of area of that. What is autism, and what are the things that we can help with autism?
Again, with autism, this is another neurodevelopmental disorder, and when it is present, there can be impairment in social interaction, communication, and repetitive behaviors can be present. And there are a lot of other subtle things which we look into, like imagination and creativity and other areas where the people struggle with.
And that's autism.
That is autism.
That is autism. Yeah. And can it be treated? Is there a treatment for it, or is there a sort of symptoms you look for? Those are the symptoms you look for. But is there a management strategy, and do you look after patients with autism as well? Abi.
So autism, or a slightly expanded version, is autism spectrum disorder. It's just because they can be, like I was saying earlier, mild, moderate, severe. The important sort of point in autism compared to ADHD is we don't have a treatment for autism. It's a neurological, neurodevelopmental disorder which kind of persists. But there are several aspects of autism which can be managed to improve things,
outcomes
with the functioning. The other thing you need to be mindful of is that along with autism, you can sometimes have added mental illnesses that come along. For example, depression or OCD, which can be treated. So autism itself hasn't got a cure at the moment, but there are several things that we can do to help and manage. And a big part of is that's awareness. Lots of people struggle with not understanding what's happening with my child and why they're behaving like that. Once they get a diagnosis, then they're able to understand that a lot. We use a term called psychoeducation, essentially psychological education about what the condition is, how does it manifest, what happens in the home environment that can make it worse, or what can you do to try and sort of manage it a lot better. So that's why it's sort of manage in a more holistic approach.
Holistic approach. And but there's some autistic people out there who are leading in their own fields. You know, there's some amazing cases when you listen to some of the autistic people in the country.
And that's why we got to be mindful that
Because they're geniuses in some ways.
we need to be mindful that we do not sort of label autism as a very sort of negative disorder.
It's very positive as well.
It can be.
It
but
can be.
You need to be mindful of how to
Manage it.
how to be aware of your difficulties and then put the strategies in place to manage that.
Yeah.
I think one name that I use quite a lot to sort of explain to families is Chris Packham, who does wonderful presentations on BBC.
Yes.
And he's openly talked about, and he's got a wonderful program about Asperger's and me, which I give reference to for my patients to look at.
Yeah. So there are some brilliant people out there with these conditions who are just managing them really effectively. We're going to be talking about anxiety, which is a big issue at this moment in time, because Leicester was on lockdown. We had lots of people who were sort of living in isolation or having to deal with life on their own for a long time. And young people were outside of school, outside their social circles. Anxiety is a big problem. How can we deal with that? And what do you need to look out for?
I think anxiety at different levels we treat. First, people would need to have a better awareness of identity by the parents as well as young people. The second thing is the school has got counselors who can help with that. Then if it is really the things have deteriorated, they can be referred to CAMS as well, which is Child and Adolescent Mental Health Service. And in CAMS, what we look for is obviously there can be group therapy, there can be individual therapy. Whenever we are talking about the management of anything, it has to be evidence-based, and it also has to be individualized for that individual young person we are treating. And that is why, and then there can be psychological therapies, and in addition to that, there can be medication as well if needed. And what the trust and locally they have done, there is, if you go on the Trust Leicester Partnership Trust website, there is a lot of guidance, and there are a lot of videos in different languages as well, which you can go and see for anxiety, for depression, for neurodevelopmental conditions as well. So that is one thing. We also have to obviously tackle it at media level and all other levels as well, because young people are becoming more and more anxious because they are exposed to a lot in the media and they have access to a lot, and that makes a difference as well.
Yes, sorry, Abhi?
You mentioned lockdown, and
Yes.
the impact of lockdown. I think what our experience tells is that it has had a significant impact on not just young people's mental health, but across the whole population. One significant aspect of lockdown was this sort of position of not knowing what's going to happen. And a lot of people struggled with that. Yeah. In addition to that, the lockdown meant lots of people were spending a lot of time on mobile phone, computers, and then that sort of comparison of self to others, and that sort of has had a significant impact. We've seen referral rates go up in CAMS for young people who struggled with
that huge problem. Yeah, there was a couple of questions that came in earlier on this morning to me. We've covered some of them. What is the average waiting time for referral to community paediatrician for initial consultation following a GP referral and the assessment of neurodiverse conditions? We sort of covered that. There is delays, but then they go on to ask the question is, is there a national shortage of paediatricians?
I think here again, when the referrals come, the younger ones go mainly to the pediatricians, and slightly older ones or the ones with mental health problems come to community mental health team. And I don't know exactly how long is the waiting list, but I know the waiting list is quite long. There is a waiting list, but the good news is that we are working very hard to cut down that waiting list and work on that. There is a pathway development, and first we developed a business plan, and now there is a pathway. And more we are trying to recruit more people to cut down the waiting list. The other issue here is not just funding or the money. There is also shortage of trained people, the trained clinicians or professionals who can come and take on those jobs. But both nationally and locally, a lot of work has been put in because it has been identified not diagnosing young people in time can have long-term effects. And I think the longer they wait on the waiting list, the disadvantage is that they become more unwell and then they become acute, and then acute has been taken up and seen. So that's why I think we are fully aware and trying to do a lot of work at every level.
Yeah, so hi, we've got a message come in. Hi to the doctors, it's great to listen. Thanks for doing this show. I have a son who's 10, has diagnosis of autism. I was lucky to get my son a diagnosis at the age of 3, and he has gone leaps and bounds since his EHCP and the support in school from the from the family. My process was smooth and swift. Wishing 6 months I got a diagnosis, but things are very different now. I have so many people approach me with younger children who are now struggling to get their children diagnosis. These people have been to the doctors but keep getting fobbed off. My question is, there is a shortage of funding, but what do we advise them to do? Meant within 6 months I got a diagnosis. So it's lots of people are getting diagnosis a few years ago. They're obviously struggling now. GP is the first route of call. They're obviously struggling, but what would your advice be? My advice would be contact your local counsellors and they can put pressure on the NHS to try and make sure that they try and ease this pressure, because it's about the political pressure that needs to be applied to make sure that the funding gets to the CAM services. So we make sure that not only do we recruit more consultants, but we retain the ones we've got, because there is a level of burnout as well. There is lots of pressure on doctors like you who are working up and down the country, who are struggling with the sheer workload that you have.
So if I take that sort of point that's raised, so yes, that gives you sense of an average length that takes for an autism diagnosis because of the information gathering and kind of thing. And then the interesting thing is the response, and what they are saying is not just the medication. We've not talked about medication for autism. It's the EHCP. Exactly. Which stands for Education, Health and Care Plan, and the support in school environment. Yeah. So those kind of things are very useful. And similarly, we need to be mindful that it can take a long time to wait, but schools have become equipped with lots and lots of mental health practitioners who go and support. So the initial kind of support can be accessed from there. They can give you some simple strategies to manage things at home. And while you're waiting for a diagnosis to come through,
you can actually get that work done in the background.
You can start to sort of do some of that work. There are, like Dr. Khan was saying, there are lots of useful stuff available online. But one thing we need to be mindful of when we go online, not to just rely on YouTube and information there, go for an authentic source. YouTube might have sort of chance. For example, we'll be comfortable to recommend go to the Royal College websites. So Royal College will have an authentic.
So that's the Royal College of Psychiatrists.
Yeah, we're not part of the pediatricians. The question that earlier came on was from the pediatrician, but I'm sure the RCPCH will have different sort of information.
So go to a trusted source. Yes. So it's NHS, Royal College of Psychiatrists, Royal College of Pediatricians. These are trusted sources, and they will have probably lots of their own videos and own support, and own information on there to help families to just preempt something.
And for autism, I would say NAS, the National Autistic Society. There's a wonderful website, has got lots and lots of information and lots of self-help support groups as well, where parents can join and learn from each other what did they do to manage things while they were waiting, or post-diagnosis, what have they done to sort of manage their young ones.
And there are local as well, websites like My Guidance, Autism Space, and if you are on the waiting list, you can even go to the Trust website. And it's not just in English language. There are videos in different languages, even on National Autistic Society. I mean, I've done on Punjabi and Urdu, so I know we have done in a lot of languages, Gujarati, and so there is a lot of information available which they can
access. So, as I said to you, a message from Taz, seek help from the schools, seek help from the GP services. Look on these websites, national websites, the trusted websites for support and help, and contact your local councillor, your local MP, just to put pressure and make sure that we can do whatever we can to make sure that the consultants and the facilities available locally in the NHS to try and get these appointments done as quickly as possible. Really, that's really the crux. And we need to retain staff. And this is a great opportunity for me to say, on behalf of the people of Leicester and Leicestershire, thank you to all the hard work you do. I know that you're incredibly busy people all the time. When I've contacted you, I know that in the past, you've got so many cases that you deal with, and you and the whole of LPT, lots of the staff, you go over and beyond what you need to be doing, just because you have a passion for caring and you want to do best for your patients. And a real thank you on behalf of them, because they don't always have the opportunity to say thank you, but because they're not always well, they're under stress, they're under anxiety, because they're worried about their children. But thank you, because you can see, just from that message, how much of a difference it has made to people's quality of life. It's a huge difference.
Thank you.
Thank you. We're going to now talk about depression, because we've spoken about anxiety. So depression is another form. What's the difference between anxiety and depression? What are the key indicators we should be looking for in young people?
So depression can be present in young people as well. It's not just a condition for adults. And the presentation is fairly similar, that you'll see that the young person is starting to withdraw from the normal activities, the fun and enjoyment that they used to have. They'll probably feel a lot more sort of isolated. They won't be sort of enjoying things that much. Their ability to concentrate and do the work that is expected in school will probably go down. And those kind of starting points should alert families to ask for help. Teachers are aware of those kind of things. So socialization, withdrawal, and lack of energy, lethargy, those kind of things will be the first things that start to manifest.
So something like if a child comes home and then he doesn't leave his room,
yes,
he's there and he doesn't come and communicate with anybody, sits on his own, doesn't really have any friends, doesn't really interact, doesn't want to go out, doesn't
Absolutely.
play football, doesn't go to...
And a good sort of thing to notice is what they were doing, let's say, 3 months before, and what is the change that they can observe now.
So they might be very active at the start, and then all of a sudden they go insulate on themselves.
No, I would say not all of a sudden. It's a gradual process.
Gradual process.
It's more of a gradual process that you'll notice and that's what I'm saying. So if you compare that, okay, 3 months ago they were able to do this and this and this, and now they're sort of mainly staying in the room. They're not engaging, interacting, and some of them, not all of them, would sort of exhibit the tearfulness and the crying and sort of those kind of things. But it's not very common across the board. But those kind of pointers would help you to sort of start to think. It's a serious condition. It's a serious condition which needs to be managed. And then associated with that is sometimes people present with self-harm.
Yeah.
And that's what we need to be more mindful and feel comfortable to talk about that. It's not something that if you talk about self-harm, you'll push people to do more self-harm, but it kind of helps them to be more open about that. And it's what we call a maladaptive coping strategy. They're trying to manage, they're trying to cope, but they've gone to a wrong way of managing themselves.
And obviously, if you think your child has got this, what would you be doing? And how can you deal with it? How can you get them out of that circle? It's a downward spiral, effectively, isn't it? How do you manage that, and how can you sort of, because sometimes the child say, I don't want to go to the GP, I don't want to go to the doctor, I want to stay at home, I'm not talking to anybody, I don't want to go anywhere. How do you deal with that kind of scenario?
So if I sort of take that as a bigger picture of what we would use the word engagement, the struggle to engage. So we have lots of teams who are able to try and not just sort of look at them when they come to the clinic, but go and see them at home. So for some of the, what I would say, complex or challenging cases where they've struggled to engage with us, we have colleagues who would go and see them at home. In terms of the acute presentation, when they present with self-harm or they present to A&E, we have got a wonderful crisis team. We have got teams which will review them straight from the A&E and then help and work with them, where the staff members go and talk to them and work with them and in the home environment.
And is this a common condition? Is this happening?
It's very common. Depression is becoming more and more common. And I think it's because of the challenges of the world and whatever is happening with COVID, with wars, with what they are seeing on the media. And then use these maladaptive behaviors of drugs, alcohol, and the things which make it worse. And in addition to that, they'll just be withdrawn. And I think that's where both parents or the carers and can intervene and can see and can identify the changes. Teachers can identify the changes. That's why somebody is withdrawn.
And there's lots of issues within the schools as well, because
Yeah.
kids feel isolated. Social media is playing a part in this. They feel isolated, not being part of the gang, not being part of the group, and then they withdraw into their own sort of thing. And I think, is the school element an issue for them? Because sometimes they could be happy at home, and then when they go to school, they're depressed, and they come back, and then it starts to translate into something else.
Schools can be a source of stress if the young person is not sort of feeling comfortable in that environment, surroundings. But the teachers are very well equipped to pick up those kind of points. And as I was saying earlier on, there have lots of teams which have been established mainly for that purpose, where there are mental health professionals who go into the schools. So if you have got any worries, and I would say feel comfortable to be open about it. The more you're open and ask that question, that look, we are seeing a difference, or there's a performance drop.
Speak to the schools.
School teachers are very well equipped, and they can sort of link with the nurses who are coming there, or mental health professionals who are there, to sort of get an initial assessment. Or even they can do what I would call a low-level therapy, or some sort of treatment within in the scenario as well.
So there is lots of support available in the school. Parents need to talk to the schools, need to talk to the children, but definitely talk to the schools, saying, "Look, actually, I've noticed this bit of change.
Yes.
Is there anything you're noticing at school? And is there anything you can do to help?" That's the kind of conversation.
Exactly.
So you don't actually need to go to the GP first. You don't need to go to the extent, but initially, that's the best course of action.
And it's being open with the young person themselves and having that conversation, and in that sort of context helps.
It helps, yeah. Talking to them. But, lots of young people are withdrawn generally because, we've got this big problem of, we're going to talk about this anyhow, mobile phone and, people on their screen, the screen times, it's a huge challenge. I can imagine some people who are listening to this, their children must be on their phones for 6 hours a day in some cases. And it is scary. It's that part of this issue, is that dragging people into this anxiety and depression? Is that part of the cause?
I think one thing I want to say is I don't want to sort of criticize mobile phones as such. They're a very useful tool.
No.
I use them.
Everybody
uses them. Now, the balance of use needs to be that it's used for appropriate things, and we shouldn't be spending time mindlessly scrolling through different videos that come through and on our screen.
I'm guilty of that.
How much time do you spend on that?
Yeah,
That's the question.
And actually, I sort of thought about this a few times, and I'm scrolling, I'm thinking, that's 10 minutes gone.
Exactly.
And then I've scrolled, and I think, that's an hour gone. And I'm thinking, what am I doing? Wasting my time. Yeah. Then I switched off, and I thought, this is ridiculous. Yeah. Because actually, before you know it, you've wasted 20 minutes, 40 minutes, just looking at random sort of videos. It's not good.
It's not good. And what we are seeing is the more evidence coming through is that it's having an impact on the pathways in the brain, where you start to sort of feel a reward for that sort of exciting new piece of information that comes through. And over a long term, in a very sort of...
So it gives you a buzz, effectively.
It gives you a buzz, yes. And in a very non-technical term, if I can use it, I tell sort of my daughter that you are literally frying your brain.
You're frying your brain.
You're not helping, because you need time for the brain to rest, settle down. And you need to give that time, because otherwise your brain's always active. And that sort of overactivity doesn't help. And then it leads you to other sort of problems, anxiety, depression, and other sort of challenges.
Your brain needs to slow down and sleep effectively and take it easy. And slowly take that information in, not on binge, effectively.
Not on binge. And what I say to parents is have that conversation with the young people. They will use mobile phones, but try and see if you can have some agreement about sort of what time the mobile phone needs to finish. You need to make sure that the mobile phone comes out of the room or doesn't stay in the room. It gets charged outside rather than staying with the mobile phone through the night and stuff like that. Get some sort of an agreement established within the home environment. What's a useful time that you're going to be staying on the phone? And lots of things have come in terms of when you can block the phone usage, you can sort of manage that. But that agreement from the young person would be the best way to manage it.
That's always very difficult, though.
It is.
Yeah, I can imagine dealing with one of my sons and saying to him, "Well, you're not having your mobile phone after 9 o'clock or 10 o'clock." Oh my God, that would be absolutely difficult, really challenge. So it's not an easy one,
No,
Dr. Ratore.
no. But that's why I'm saying that having the regular conversation about that would be a useful thing.
Okay, we've got a message coming in. Sorry, if I had known 12 years ago that what my son would go through, when I would never have put him through this fast. The system needs to change, pathways need to change. You need to be educated from parents that live with this day in, day out, and like me, and do something about it. We are undervalued, misunderstood, tired of fighting. Nobody ever told me I would have to fight for the most basic needs, and that's what's happening now. What happens when I'm not here, and what price is it having my health? There's a major problem out there with this, because I can certainly associate with that, because for a parent as living with a child who has issues, it's a challenge, it's a fight, yes. and the system there just does not work sometimes. It clicks on occasions, it clicks for some people, but sometimes when you're having to fight to get single thing done, it's a challenge, and I'm sure you see parents who struggle with that.
Yes. And that's what we're saying. Sometimes when we see that parents have waited for sometimes a year or sometimes 2 years to get a diagnosis, and the kind of relief we see on their faces that, okay, at least now we got the diagnosis, so at least the next set of things can happen. For example, ADHD medication can start, or a diagnosis of autism, then they can start to sort of get some help organized in school or move to a different school with special provisions or whatever is required. So it is a big challenge.
And I think that is something, it's very painful to listen to parents like this. We are parents, we can understand what it's like. But I think the only positive side for the future is that there is better identification of the needs. But still, there is such a big gap at every level. And that has been recognized nationally. There was a time 10 years back that only consultants could diagnose ADHD and ESD. Now things have changed, and now there is an MDT. Now there's better identification, more referrals. There are things like a dynamic support register. When they deteriorate, even a parent or someone can refer on that. Then there are specialist teams. But still, Abihay is an inpatient, he's an inpatient consultant, and he would tell you that so many times we have to admit young people because there are not enough residential placements or educational placement or special needs of these young people. Just by getting that specific help for those young people can make such a big difference and reduce so many admissions, improve the quality of life. I can come up. I've published on this topic many cases. And I think this is something which is identified and work is being done at all levels, but we are still far behind. And I totally, but I can give you reassurance from both Royal College understands and locally there is an understanding of what
I think all the listeners can tell from what you've just said, both of you, that everybody cares, and we are all trying to care for our children and do the best possible for everybody. But the system just doesn't always work properly. By all means, people can get in touch with me or your local counsellors, and they can put pressure on the NHS locally, and we can all try and work together to try and improve the situation. So it's not always within our gift, but we can at least try. And I can assure you that, lots of the NHS professionals across Leicester and Leicestershire, they really do care about what they do, and they deliver a fantastic service. But there's always going to be issues, and we always try and make sure that we reduce those amounts of issues and try and help each other as much as we possibly can. We've got another message coming in, more training required in education. That's obviously got to be part of it, hasn't it?
And yes, I would say there's a lot of awareness already out there, and teachers do have a lot of training, and they're linked together with the mental health services, and that's why we rely heavily on them to pick up the young people who start to present with those kind of difficulties.
And actually, that's part of the conversation is not just go to the GP, go to your schools, speak to them, look online, look for the autistic societies, look for those other sort of avenues where there is quite a lot of support available. And even if there isn't that support available, let's create support for those families. Let's have those autistic classes and groups of parents. I went to recently a diabetes coffee morning, and it was all the diabetic people getting together, having a coffee, and they were talking about their treatment. This works for me, this doesn't work for me. I do this. I walk in the mornings, or I go for a jog, or I go for tennis. They actively try and manage their condition, and they talk to each other, and it's so good to see that because they can bounce and support each other, and it's really good. And I just think we need, as an ethnic community, an ethnic minority, we need to be open to these ideas, and we need to be thinking, how can we help others rather than just ourselves, and support families. And it's a great opportunity for us to do that. And I actually don't think we do that enough.
Yeah, and I think there's definitely a lot more scope for creating more stuff in that sort of ethnic minority
support,
space.
Yeah.
Yes.
Yeah.
And I think, at least I can give that much reassurance that the trust is doing a lot of work, both for ethnic minorities as well. I can give you one example that we did a pilot in 2019 for first 50 cases of neurodevelopmental, first 50 referrals, and there were only 2 from ethnic minorities.
Yeah.
And 48 were, whereas the percentage of my ethnic minority is not 2%.
Yes, 50%.
And all these things have been looked into, and a lot of work has been put on. But obviously, it's a long way to go. But there is a pathway, there is transformation work going on, and but still, there's a lot more to do.
And one of the other topics we're going to be talking about is gaming. Gaming was on our list. So, PS4, PlayStations, Fortnite, and all these FIFA footballs. What is because lots of children out there during Ramadan and just generally sitting there playing on their PlayStations, passing their time. How damaging is that? And why is it a problem?
I think gaming has been identified as an addiction to some extent.
It's an addiction.
It is. People do get addicted to it, and especially the young people. And but it's also a maladaptive behavior as well. For example, somebody with ADHD, they spend hours on, if they are not managed and they are untreated, they get that stimulation from the game. And that's why they would spend a long time sitting on the game. In the same way, people who are depressed, if the depression and anxiety is not managed, they think that just sitting, and that distracts them from the realities of world. So it's not just working on that area, which we need to do, and the therapies can help. But in addition to that, you have to look at a bigger picture. For example, when we are doing neurodevelopment for assessment for ADHD and ASD, and it comes as negative that the person does not have ADHD or ASD, then there must be something. Parents are struggling.
Yeah.
Young people are struggling, so you need to identify. Yeah. And then it starts another assessment.
It's so good to see both of you are focused on the parents and what they need and the support they need, which is absolutely fantastic, which is exactly where you need to be, because it just shows the care and the compassion that you have for your patients. It is really good to see, and I hope that transpires across the whole of the NHS. And we've got a message coming in. It's not just about the younger generation. Depression is so common with the first generation too, where communication was very little within couples, not much support available or recognition with postnatal depression, especially within the Asian community. Mental health is such a taboo subject. I think within the local community, it needs to be recognised that depression is a chemical imbalancement. Can I say this kind of thing where you guys are, what you guys are talking about is so brilliant? Need more of this. Thank you. So thank you very much for that message. Very kind words as well. It is about trying to really seek help.
Yes.
From wherever you can, within reason, and you guys are doing a brilliant job.
Thank you, Zuffar. We are trying, and we do sort of recognize the kind of the significant need that is out there. And And like you say, there's a good thing, there's a lot of help available. And one positive of the pandemic was a lot of stuff has moved online, and you can access lots of stuff online. But as I said earlier on, be mindful where you access those kind of things.
Credible sources.
Credible sources.
We're running out of time, so just wanted to say a big thank you,
Thank you.
Dr. Rummana Khan. Big thank you, Dr. Abihay Ratore. Thank you very much for listening. You're listening to Radio Ramadan on 87.7 FM. This was Your NHS, Your Health. Hope you join us again. We'll be doing another couple of shows in the next few weeks, so please join us. Assalamu alaikum, and hope you have a great Ramadan, and